Welcome to Ultimate Skincare and Beauty Report. I'm Mary Winkenwerder. For the diabetic, there are many challenges that face daily care. One of these challenges is identifying skin conditions. Another is knowing how or learning how to treat them. Joining us this episode is Dr. Saini from MD Dermatology to educate us on 5 diabetic skin conditions and how to treat them. Dr. Saini, welcome to Ultimate Skincare and Beauty Report.
Oh, thank you so much for having me. It's a real pleasure to be here, and it's so important we educate everyone about diabetes.
That's wonderful.
And November is American Diabetes Month. Over 29 million people in this country have this disease. And diabetics are more prone to developing various skin conditions, and educating everyone what to look for is what is so important, why I'm so passionate about educating people about this.
That's wonderful. So the skin conditions can reveal the signs of diabetes. Let's talk about 5 common skin conditions that reveal diabetes.
Absolutely. Diabetics are more prone to developing skin conditions because of a couple of different reasons. The high blood sugars depress the body's ability to fight infections, and through different mechanisms. The other thing is that the longer someone has high blood sugars, it also destroys nerves and vessels, and it also decreases the body's own antioxidant system.
Wow. Wow.
And yes, in fact, that's one of the reasons why diabetics, because of high sugars, they're more prone to getting bacterial infections. Almost every single person can get will usually be a more frequent and sometimes a little bit more severe in a diabetic. And one of the common type of bacterial infections that can occur are styes in the eyes, or also infections of the fingernails. Hangnails, as sometimes people get them, but also sometimes diabetics, because of the increased tendency to get infections, they also get a normal infection of the ear. The outer ear can sometimes be almost life-threatening in a diabetic. And foot infections can occur, different type of infections. So bacterial infections, if someone is a diabetic, the higher their blood sugar is and the greater the number of years someone's been a diabetic, the more attentive they need to be to checking their feet, their hands, everywhere, once a day. Fungal infections, yeast infections, there's candida that can inhabit different areas of the body, but can also involve the skin. People don't realize that. So yeast infections can occur between the toes or in the folds, because those areas tend to stay moist. And the fungal infections, oftentimes I'll recommend to someone who's a diabetic, use a powder like a Zeosorb powder is an excellent one that absorbs moisture, and it also has an antifungal in it also. And that's a very nice thing to be able to control infections, fungal infections and yeast infections every day. The other thing is that there's 2 different types of diabetes. Type 1 and type 2. And it used to be called that type 1 only occurred in children, and type 1 would occur after, say, a mild infection. The body's immune system would actually shut off all the insulin-producing cells and actually destroy them. And that's called type 1 diabetes. Type 2 diabetes is the one that slowly occurs as people get older, and that occurs more gradually. For a number of reasons, the body becomes more resistant to the insulin it produces, but also those islet cells, the ones that produce insulin, actually seem to form deposits around it that slowly shrink and then interfere with their ability to make insulin. And type 2 diabetes is the one that the nation's seeing an explosion of diabetes. And it's also linked to weight, and if someone's overweight, someone even losing pounds, it can do a dramatic difference in improving their blood sugars. But one of the other skin conditions that can occur is called Acanthosis nigricans. And these show up as brown, velvety patches that can occur around the neck, the underarm, sometimes on the hand, sometimes also on the elbow. And that can occur typically with type 2 or adult onset diabetes. The other one is diabetic dermopathy, and this is where the skin typically over the shins, can form pigmented patches. Oftentimes they don't itch, but occasionally these can itch. Sometimes these are also accompanied with loss of hair on the shins too. And then one of the other common conditions that can present is diabetic blisters or bullosis diabeticorum. And these typically are painless, and they oftentimes heal up by themselves. And the thing is about the most important thing is treating these conditions to make sure they don't get secondarily infected. But one of the most effective treatments is to actually bring someone's sugars under control.
Okay, so let's talk about let's revisit bacterial infections. If somebody recognizes a bacterial infection, or say somebody, one of your patients has a bacterial infection, how can they be successfully treated?
Main thing is to clean it, and antibiotic ointment over the counter. I personally like bacitracin and zinc because
Okay.
of the zinc component in it. It's both an antibacterial and an antifungal also. I like that. And then the main thing is the reason to use an antibacterial ointment is wounds will heal a third faster if it's covered with an antibiotic ointment than if they're left dry. So keeping a Band-Aid on it to keep the ointment in place, that's one of the most important things. If it's something that's not resolving, but especially if it's getting worse, the single most important thing I can mention to your listeners is please see your primary care physician or your dermatologist.
Yeah, I'm sure that's, especially with a bacterial infection, that's very important. So let's talk about fungal infections. How can a fungal infection be addressed successfully from start to finish?
There are, one of the key things is moisture control. So using a powder that can absorb the moisture is an important thing. The other thing is that topical antifungals can be used also to control it. Oftentimes if someone is prone to chronic infections, one of the chronic groin infections, jock itch or tinea cruris as it's called, or athlete's foot, I oftentimes recommend people use cotton and then also bleaching their underwear, bleaching their socks. That's a good way to prevent infections. Using a topical antifungal. There's some very good ones that are now over the counter that can be used. And then also powder to help absorb that moisture. That's one of the best things that I found to help control that.
When addressing a fungal infection, internally, is there anything that we can do, like any type of diet monitoring of that sort?
That's interesting because the things that elevate blood sugars are the things that can increase fungal infections. So one of the most important things is bringing blood sugars under control. It is controversial. Some people argue that things that have yeast in them, bread, wine, can also aggravate topical skin infections. I haven't seen it, and the studies haven't seen it, and I've been in private practice for 23 years now.
That's good. So let's talk about the Acanthosis nigricans. I hope that I said it correctly.
You actually pronounced it very well. That's
Thank
excellent.
you, thank you. So if you determine, or if somebody's doctor determines that they have this, or if they're aware of the fact that they have this condition, so how can this be successfully addressed from start to finish?
It's a difficult condition to bring on. The best thing for this condition is weight control and also bringing the sugars under control. It's interesting because this is one of the few conditions that actually can precede the diagnosis of diabetes. So if someone develops this condition and getting these brown velvety patches and plaques that they're called in on their body, their underarms, their neck, their arms, see a dermatologist and see their primary care physician, because sometimes it can actually lead to the diagnosis of diabetes is about to occur. But weight control is usually the best treatment. Creams of different types can sometimes help also bring it under control too. And the key thing is blood sugar control. It's amazing how so many of these conditions, when the blood sugars are brought under control, typically there's one number that every diabetic should know, and is their hemoglobin A1C. What that refers to, it's the blood sugars are actually glycosylated, or they bind to the proteins inside different parts of the body. That's how they cause damage. But that's also a reflection of what your blood sugars have been running for the last several weeks before the blood was taken. Typically, someone who's a healthy person who's non-diabetic, their number should be below 6. If someone is a diabetic, good control is having that number under 7. But I've seen some people whose blood sugars have been out of control. Their hemoglobin A1C was actually at 14.
Wow.
So and I find that if their A1Cs are consistently 10 and above, that's when I see a lot more side effects and skin problems coming up in a diabetic. So once again, I mean, from when I graduated medical school in 1983 to now, the thing is, studies have indicated the more closely monitored, the better the blood sugar controls are, the better someone's skin condition and overall health is going to be, because diabetes is not just a disease of the skin. Every single organ system in the body is affected.
Wow.
And that's why it's so important. This is, if someone, you cannot have healthy skin without being healthy internally. So this is one of the things that I mentioned to all my patients, is that if diabetes is a sign of sugars out of control, the better they're under control and the better the weight someone has, they're closer to the body weight, a healthier lifestyle, the skin conditions actually do improve also.
So let's talk about diabetic dermopathy. How can we successfully work with this and, address this issue?
Again, this is one, topical creams are helpful
Okay.
to help deal with the symptoms, but oftentimes what I've seen in my patients, you cannot improve this skin condition unless the sugars are brought under control. And typically I'll see this with people who their A1Cs and their fasting blood sugars are on the high side, and they're out of the normal range.
Gotcha. And then, finally, there's diabetic blisters, also known as bullosis diabeticorum. Um, if somebody has this type of blister, I mean, how is this different than a normal blister, say, you get from wearing a tight pair of shoes where you're breaking them in, or, just like a rub blister? And how do we address this? I mean, this seems to be far more intense than your average run-of-the-mill blister.
It is, Mary, that's a brilliant, brilliant question to ask. And they do, if you just took a photograph of this type of blister versus a friction blister versus a thermal blister from a
Right.
burn, they
Sure.
look exactly alike. The key thing is that these will occur on the backs of the fingers, the hands, the toes, sometimes even on the legs and forearms. So what you mentioned was a brilliant, brilliant observation, in the sense that there was not a burn associated with this, and these aren't always associated. The ones that I've seen in my career, they're not ones where people were actually getting friction blisters, like foot blisters. And the thing is, they occur spontaneously. Why they occur, we don't know. It's a fascinating question. And
Mm-hmm.
this, to me, why I love medicine, is there's so much still for each of us to learn. And
Sure.
the key thing is that oftentimes these diabetic blisters will heal by themselves without scarring. Oftentimes they may heal, take about 3 weeks. And again, what's to bring their blood sugars under control.
So, and I have another question. Okay, sometimes when a person gets a blister, it can be an allergic reaction to, say, like peanuts or something else that they may be allergic to. How can you differentiate between an allergic reaction blister and the diabetic blister?
That's a very good question. A blister that occurs from a food product or a drug, they're oftentimes fixed in nature. I've seen patients who get a blister when they've gotten the same medication. Usually they'll tend to occur on the same location,
Sure.
and once the offending material is removed, then that blister will heal. And it's interesting what I've seen with medication blisters. They oftentimes tend to be painful. They can be painful, and versus diabetic blisters oftentimes are non-painful, and they heal up by themselves. They'll just occur spontaneously. But that's a very, very good point. The thing is, what I've seen is that if people have a sensitivity to a food or any kind of ingestant, whether it's a medication or whether it's a food product, they'll oftentimes very quickly by their teenage years know what's going to cause them to have a blister. Definitely by their mid-20s they'll know what will cause them to have a blister. Typically diabetic blisters will tend to occur after someone's been a diabetic for a period of years and years.
Wonderful. All right. Well, Dr. Saini, thank you so much for joining us. It's been great having you visit with us and learning so much about this condition and
I
how to
absolutely love
identify
it.
these skin conditions and how to address them.
It's, to me, being a dermatologist is I get something wonderful every day. There's always a brand new challenge, and thank you so much for having me on your show.
Wonderful. All right, everyone. Catch up with me on my blog, www.beautybeautereport.com, and on Twitter @BeautyPublicist. Everyone, thanks so much for joining us on Ultimate Skincare and Beauty Report. Have a beautiful and successful week. Mwah!